I'm Christine Fellingham, and I'm back with another Monday Makeover. We're here again with Dr. Julene Samuels, a board-certified cosmetic surgeon in her beautiful offices in Norton Commons. And this week, we're talking about a topic that doesn't get a lot of discussion: intimate female wellness. Dr. Samuels, last week we met a patient of yours, Charlotte, who had a really positive, life-changing experience with you.
Yeah.
Can you talk to us a little bit about what you can do for women in this area?
Right. Well, as you know, I take care of women of all ages. And so I think one of my philosophies with really every surgical procedure I do is, what else can I do for them non-surgically? So for me, it started with surgical labiaplasty. And then just like a facelift patient receiving skincare evaluations or laser recommendations, that full spectrum of care, I became aware of some vaginal device treatments that could also help women of various ages. I do clinical research for 3 of those companies now, and we have 3 vaginal devices that really we select according to the patient's symptoms and age. So if a patient is postpartum and dealing with laxity or problems with intimate health due to childbirth, weight gain or loss, and lubrication is not an issue, then I usually turn to one of our radio frequency devices, either the Exless 360 or UltraFem 360 or the Votiva Forma V. If I have a menopausal patient who also is experiencing problems with urinary leakage, dryness, itching, problems with intimacy, tightness, then I use the Core Intima laser for faster restoration of lubrication, elasticity, flexibility. And then we have the chair, the Emsella chair, which can also improve sexual function as well as to treat urinary incontinence. And then we have the O-Shot. So it's a constellation of services that can help women with a constellation of symptoms.
So Dr. Samuels, this is a one-time treatment, or is this something you do in a series of treatments?
Well, all 3 of our vaginal devices, for best results, require a series of treatments. So we do 1 treatment every month times 3, and then we will do a 12-month maintenance treatment. So, and the patient owns their handpiece. It's a single patient use hygienic handpiece. They can do more than 3 treatments in their initial series if necessary and if their symptoms warrant that. But the studies that I have personally done show that patients all receive some benefits beginning after just the first treatment, but the results are more long-term and sustained if they can do those 3 treatments. And then the results approach 100%. In addition to the in-office treatment series, we also offer VFit Plus now, which is new. That's something that patients can do at home in between their in-office treatments and also after a completion of a series to maintain the results. It's a device that uses gentle warmth and red light technology, which has a lot of science behind it to help maintain these results long-term.
So what kind of downtime can we expect with these procedures?
Well, the laser, the Core Intima laser, only requires 2 or 3 days of not putting anything in the vagina and no intimacy. The radio frequency devices have no downtime, so patients are able to get back to their normal activities immediately.
So little or no downtime, no anesthesia, and improvements for all ages of women. Thank you so much for bringing these treatments to us, Dr. Samuels. It's really great news for women. And next week, we'll be back with more on intimate female health, and we'll be talking about the O-Shot, PRP, and labiaplasty.